Hi! Sometimes you may get scenarios where you have to deal with non-cooperative patients in OET speaking. This can be quite challenging as the candidates find it difficult to find the right choice of words to convince the patient or the right strategy. So let's delve into some effective strategies for tackling role plays with non-cooperative patients. First point, active listening. Listen attentively to the patient's concerns without interrupting. Acknowledge their feelings and validate their experiences. Second point, empathy. Show empathy by acknowledging the patient's frustration and validating their feelings. Let them know that you understand and are there to support them. Third point, patient education. Explain the importance of the treatment and the potential benefits while also addressing any concerns or misconceptions the patient may have. Fourth point, collaboration. Involve the patient in decision making regarding their treatment plan. Offer options and alternatives and work together to find a solution that meets their needs. Moving on to the fifth point, support. Offer emotional support and reassurance throughout the conversation with the patient. Let the patient know that they are not alone and you are there to help the patient every step of the way. Now let's look into a scenario. Nurse is entering the patient's room. The patient is sitting on the bed looking disinterested. And let's see how this conversation can go. So imagine the nurse is saying, "Good morning, Mr. Smith. How are you feeling today?" And the patient said, "Not great, to be honest. I'm just tired of all these treatments." So how can the nurse respond here? "I understand this can be frustrating. Can you tell me more about what's been bothering you?" Imagine the patient is saying, "It's just that nothing seems to be working and I'm tired of all the side effects." How can you respond here? You can try something like, "I see. It sounds like you have been through a lot. We are there to help you feel better. So can you tell me specifically what side effects you have been experiencing?" So imagine the patient is telling you, "Well, the medication makes me feel nauseous all the time and I'm constantly fatigued." So how can you respond here? You can try something like this. "I'm sorry to hear that, Mr. Smith. Let me make a note of your symptoms. Have you mentioned these side effects to your doctor?" So the patient is saying, "Yes, but they just tell me to stick with it. I'm not sure how much longer I can." So this means the patient is really frustrated. So how can you tackle this situation? You can try something like this. "I understand your frustration. It's important for us to address these side effects so that you can feel more comfortable during your treatment. Let me talk to your doctor and see if we can adjust your medication or find alternate solutions." See how the patient is really cooperative to you right now? It's all about the choice of words that you select and trying to convince the patient in the role play. So next time onwards, try these 5 methods while you're handling with a non-cooperative patient.